Hi, I'm Dr. Prem Daisy. I'm an aesthetic consultant at Angels Luxe, Gachibowli, and today let's talk about hair.
Doctor, why am I losing so much hair suddenly?
Hair fall can be because of stress, genetical conditions, scalp conditions, and other nutritional deficiencies. Get your scalp checked by a doctor and get your evaluation done properly.
Doctor, can hair really grow back after falling?
Yes, if the follicles are alive, we can treat them with GFC, PRP, minoxidil, and other lifestyle changes which can help revive the hair back.
Doctor, are PRP and GFC the same thing?
Yes, both use your blood to stimulate growth, but GFC is more advanced and it has isolated growth factors for better results and lesser downtime.
Doctor, when should I consider a hair transplant?
If you are seeing visible balding or hair thinning is not responding to any medical treatments, then you should consider a hair transplant.
Doctor, is a hair transplant permanent?
Yes, the transplanted hair is resistant to hair fall and also grows naturally, but maintaining your existent hair still needs proper care.
Doctor, does a hair transplant hurt?
No, it is completely done under local anesthesia, and post procedure you might feel little discomfort, but it is totally manageable and it's temporary.
Doctor, what is the downtime after a hair transplant?
Most people resume their normal activities by 2 to 3 days, but complete recovery and hair growth is usually seen by few months.
Doctor, how soon can I see results after a transplant or PRP?
With PRP or GFC, slight improvement can be seen within 2 to 3 months. After a hair transplant, new hair starts growing after 3 to 4 months and complete recovery can be seen after 9 to 12 months.
Doctor, can women get hair transplant too?
Absolutely. Any woman with female pattern hair loss or hair thinning can benefit from hair transplants when done selectively.
Doctor, I have diabetes. Can I still get a hair transplant?
Yes, you can. If your diabetes is under control, we'll assess your health first and make sure it is safe for you. The most suitable methods are DHI and Sapphire FUE, which are minimally invasive and promote faster healing. Among these, DHI offers the most precision and lesser bleeding.